So of the roughly 60 to 70 of these that I've done in the office, I've only gotten results less than what I desired or less than what I thought I would in about 3.
Good statistics.
Very good statistics.
And what do people say if they come back a week, 2 weeks later? What do they tell you? What kind of feedback do you get?
Yeah, you know, I'm glad you asked that, because one of the important things that I do in my practice is we give everyone a SNOT 20. Now that's what it's called, SNOT 20. And it stands for Sino-Nasal Outcome Test. And it's 20 questions. When you come in for us to do your procedure on you, because I know you're going to be in after hearing this, what we'll do is we'll have you fill out a questionnaire, and it's 20 questions. And you grade the symptoms that you have from 0 to 5. So I give you that before we do anything on you, before we do procedures, before we do allergy testing or anything else. After we do this procedure, we give it to you again 2 weeks later. Every one of them, even the 3 that I wasn't satisfied with, every one of them dropped their scores. And we see patients dropping their symptom scores, answering questions in the 4s and 5s, and they will drop them to 0s and 1 every time. And so that's the way that I monitor whether or not it works well.
Interesting.
And the numbers and the statistics we're getting are just really quite phenomenal.
Putting yourself in the place of the patient,
Mm-hmm.
what questions should they ask if they're considering this procedure?
The first question probably is, why do I need the procedure? And most patients, when they come in, will already know why they need it, because they're usually there for the headaches that they're having, the pressure that they're having, or just this constant drainage. One of the patients I saw this morning before we came here to film this was a patient that had the sinus balloon procedure about 3 weeks ago, and she was back in for her follow-up today, and the drainage that she'd been having, she says, it's gone. I'm not coughing, I'm not waking up at night with this, it's gone. And so by asking why they need it, I can go through the symptoms that they're having that they may not know are related to the problems that we're seeing.
When you do traditional sinus surgery, there's, I guess, the possibility of removing bone or tissue.
Correct.
And this is really great because that isn't necessary for you to do, is it?
That's correct. If we're doing just the balloon, we don't remove any bone or tissue. We just dilate the openings, rinse out and wash the sizes where we need to. Now that doesn't preclude removing tissue, and sometimes we do kind of a combination of the traditional and the balloon.
So what is the pain level like for the patient with the balloon procedure?
Before, during, or after?
All 3.
Okay.
Well, before we know. I mean, that's
right,
why
before that's
come
why
to
they're
see
here.
you. Yeah.
During the procedure, I've had some patients that really don't have any pain. Of course, if they're asleep in the operating room, they don't feel any of what we do.
Right.
And the patients asleep in the operating room, we've done this procedure on them. We have had patients literally in the post-anesthesia care unit, what we used to call the recovery room, that will tell us the headaches are gone. They wake up and they can tell they are gone. And then in the aftermath, even the patients that we have done in a awake or mildly sedated fashion that had discomfort during the procedure, in the aftermath, all of them say the pain's resolved.